question is, are you seeing a rise in patients wanting a COVID test?
We've seen a lot of patients. I mean, we've actually diagnosed 6 patients today. So many people are coming in with symptoms not as severe as early on in the pandemic, but they're having symptoms, upper respiratory tract, such as runny nose, cough, congestion. Some people have a lot of fatigue. Of course, we test them for coronavirus. And in a lot of cases, the tests are coming back positive. We also test for the flu. And surprisingly, in the middle of the summer, a lot of these test results are coming back positive. And then we have some patients that come in that are doing home tests just to confirm and be treated. And we'll do a confirmatory. They will have coronavirus, and then some will have the flu. So right now, the pandemic is really picking up, and we're treating a lot of patients.
Dr. Quinn, according to the CDC, it's estimated that nearly 1 in 5 people who have been infected with coronavirus have the so-called long COVID. So what is long COVID, and have you seen an increase in patients with long COVID?
Well, the long COVID is something that's still being evaluated right now because we're learning as we go through this very fluid pandemic, meaning things are changing every day. We're getting new information from the CDC and the other organizations that are evaluating individuals that have contracted COVID in the past. But this long COVID is a scenario where an individual develops symptoms when they contract COVID. Some of these symptoms, such as the upper respiratory tract symptoms, along with fatigue, headache, maybe a little bit of confusion, just not able to think as clear as they used to. Normally, when a person has coronavirus, these symptoms will subside in about a week or at least 2 or 3 weeks. But for these individuals that are having this diagnosis of long COVID, they're having persistence of these symptoms that go on for weeks and months, and some even state that they've had these symptoms for over a year. So this is something that's being evaluated and watched very closely. There are different treatments that are being evaluated as far as individuals being put on medications for anxiety, because some people have anxiety, some people have insomnia, medicines for that, looking at other treatments for the neurological symptoms. But the bottom line is long COVID is something that we might have to deal with for a lot of years coming.